QPP News team viewers. I'm here with Marlene Hodges and Michelle Brunchen, intelligent technical advisors and patient-centered medical home content certified experts. Now, both of these ladies have spent many hours helping clinicians succeed with meaningful use of their EHR and implementing clinical practice improvement activities. And they're willing to share their PCMH expertise with our viewers to help you prepare for MIPS. Now, Marlene, do you have any pointers for MIPS eligible clinicians that will help them succeed in the CPIA category?
I do, Sandy. Anyone who will be participating in the MIPS program should take time to review the proposed clinical practice improvement activities inventory found in the proposed rule that was released this past spring. A similar table can be found on the Telegen What is MACRA webpage blog.
Now, I've been on that website, whatismacra.com. It has great information, and it's easier to find the CPIA table than going out into that 900-plus page proposed rule. Now, but why would you recommend they do this without waiting for the final rule?
Well, there are over 90 activities being proposed by CMS for this performance category. They are organized around 7 subcategories. All of the activities are centered around rewarding a clinician for performing quality improvement activities. Many eligible clinicians will need to conduct 3 or more of these activities to achieve the total possible score of 60 points for the CPIA category. If you look closely at the activity, you may find some that are already happening in your clinic to get credit for. Given that the first performance year begins January 2017, it would be good to sort out which activities you currently do and others that you may want to begin to work on. If the final rule holds true to the proposed rule, you must be actively performing this activity for 90 days before you can count it.
Okay, very good information. Now, can an eligible clinician get partial credit if they don't achieve the full 60 points?
Yes, the opportunity to be given partial credit is built into the scoring of this category. The CPIA category makes up 15% of the total composite score. So the weighting of the score reflects the extent to which the clinician has achieved partial credit. Another recommendation we make to our practices is to try to align activities with the clinical quality measures they are reporting for PQRS or a meaningful use objective. Of course, this will align with the quality and advancing care information categories in MIPS. If they can do this, it is definitely a win-win for them and the patient.
Great ideas. And I always like examples, and I think our viewers do too. Can you offer any examples for us?
Certainly. I will share one I believe many of the clinics I have worked with will use, and it is part of a meaningful use patient electronic access objective around patient portals. If a clinician chooses to provide their patients with access to an enhanced patient portal to their personal health information and allows them to enter either health information or enable bidirectional communication, they will receive credit for a medium weighted activity. In the 2017 performance year, this will be worth 10 points.
Okay, now I see what you're saying about aligning and reducing some of the burden on the practice. That makes sense. Can you give our viewers an example for aligning with a quality measure?
Sure. If they also choose to participate in a systematic anticoagulation program, they receive credit for a high-weighted activity, which in 2017 is worth 20 points, and tie that to the NQF measure ADE prevention and monitoring of warfarin from the patient safety domain. If they do both of those activities I just mentioned and do not complete any other CPIA activities, adding the 10 plus 20 for a total of 30 points, or half of the potential 60 points available for 2017, giving them a score of 7.5 for the CPIA category to add to their composite performance score.
Well, that seems pretty straightforward.
The scoring for the CPIA category is pretty straightforward, but there is the work for the clinicians and staff to adjust workflows and processes to implement new activities. The time to prepare is now.
Well, thank you, Marlene. Those are some great tips. Michelle, now I understand that CMS has allowed some special considerations for small practices. How does that work?
It's quite interesting, actually, Sandy. When crafting MACRA, Congress actually legislated special considerations for the circumstances of small practices, rural practices, non-patient facing providers, and practices in healthcare professional shortage areas. These eligible clinicians will achieve the full potential score for the CPIA category if they perform 2 of the approved activities, regardless of the weighting score. The first activity that they report gets 50% or 30 points, no matter how it's weighted. The second activity reported is another 50% or 30 points. So just by doing 2 activities, they will get 60 points and have 100% for the CPIA category to contribute to their composite performance score. If they only report on 1, as you can expect, they will achieve 50% of the full CPIA category.
Well, that's very good information. But how do you know if you're considered a small practice?
Great question. CMS defines a small practice to be one with 15 or fewer clinicians. That holds true in both MACRA legislation and in the proposed rule for the Quality Payment Program. But don't forget, these tailored scoring strategies also apply to practices in health professional shortage areas, practices in rural areas, and for non-patient facing clinicians. Another thing to remember, in the proposed rule, practices that are PCMH recognized will get full credit, and those participating in an alternative payment model will be awarded half credit. Though we are still awaiting more clarification on how exactly this will work in the final rule.
Well, lots of great information, and thank you, Michelle and Marlene. We really appreciate you sharing with our viewers. There you have it, Dr. Paul. MIPS tip number 9 from Marlene and Michelle, the PCMH experts at Telligen.
Thank you, Sandy. That was Sandy reporting on MIPS tips number 9, live from the field. You can find an inventory of the proposed CPIA activities listed on our website, whatismacra.com. Take time to review the opportunities.
So let's do a recap for our viewers. First, review the list of 90 activities, and the sooner the better. Second, take time to understand the scoring, as a total of 60 points will give you full credit. Are you PCMH recognized, or do you participate in an alternative payment model? Are you currently performing any of the listed activities? Third, determine if you meet the guidelines for special circumstances, small, rural, health professional shortage practices, or non-facing patients. Fourth, consider ways you can align the CQMs you are currently reporting with CPIA activities to streamline your QI efforts.
These sound like great parting bits of advice. And that completes MIPS tips number 9. Thank you for watching the QPP News Team with Sandy, Susan, and of course, Dr. Paul. Join us for MIPS tip number 10 and check out our other MIPS tips videos for more QPP news and information.